Welcome to the 7th episode of Accessibility Now, stories about accessibility in the state of Georgia. Accessibility Now is a podcast produced by the statewide Independent Living Council of Georgia. I'm your host, Matt Shedd. Today, we're featuring a conversation with Rosario Palacios, an activist with Caring Across Generations, and specifically working on the initiative Care Can't Wait. I sat down with her to learn about her work, her story, and what motivates her to advocate for change. We actually begin by talking about her previous work with immigrant rights groups and her own experience of growing up undocumented in the U.S., and how that led her to her current role doing advocacy work on behalf of caregivers and those in need of care.
My mother was working in poultry and had not really had much health issues until she became infected with COVID, and I had to move in and take care of her.
We think you'll find her story and her work as enlightening as we do.
My first name is Maria de Rosario. I go by Rosario for short, and I am a senior organizer at Caring Across Generations. We're a nonprofit dedicated to advocacy work for aging and disability community, specifically with a focus on like caregivers, care recipients, and kind of the structures that we have in place to provide those services and to provide the care we need. So I'm actually new to the organization. I started last year, September, but I have I have about 15 years of organizing under my plate. I've done a lot of work with immigrant rights groups, some civil liberty groups, and so advocacy work is really, really my thing. But I also am, a caregiver. And so it's a really personal issue to me. I grew up actually undocumented. When I was 2 months old was when my parents brought me to the U.S. and they were actually migrant farm workers. So they had arrived well before I was born, but my dad wanted me to be born in Mexico for whatever reason. And so I grew up the first 19 years of my life undocumented here
Wow.
in the U.S. Yeah. And I was like, a native English speaker. At one point I was a monolingual English speaker. So to be undocumented, to live in that community and have such an American identity is very complex.
I'm sure, yeah. So, and you said you were undocumented until when?
Until I was 19.
Oh, wow.
Mm-hmm.
So was that something that your parents talked with you about, and was it?
No, it was really, it wasn't until I was 15. I guess maybe the signs were there when you're younger, but you don't understand immigration policies. And I always thought, honestly, I barely speak Spanish. I barely understand Spanish. I don't speak it. There's no way. I used to think to myself, there's no way I'm undocumented, because you would hear very off-putting comments by school classmates and stuff like that, or even teachers about the community. But it wasn't until I was 15 when they deported my older brother. They pulled him over because his windows were too tinted. And he had a little bit of a record before with, being in and out of jail as a youth. And so the last time that he had any issues with the police was because of tinted windows, and they put him in deportation proceedings from that. And that's when that's when I understood, and that's when my mother had an official talk with me. Yes, y'all are undocumented. She had a green card status, but we didn't. And our paperwork, I've been in the process at that point for 8 years. And so we were waiting, on our first interview. And that's when she explained to me, and I fully understood that I was undocumented. But I was 15, so that is, I think, pretty late in life to realize that you don't have a lot of privileges.
Yeah.
Yeah.
Tell me about the progression of your career and how you came to Caring Across Georgia.
Definitely. So, so my first organizing was with immigrant rights, and specifically I was undocumented at the time. And so I started attending a, community college And we were pushing for in-state tuition for folks like myself who graduated from a Georgia high school. So we were trying to do advocacy. That was where a lot of my first advocacy work started. But really, I became a legal permanent resident in 2009, and then I naturalized as a U.S. citizen in 2016. And I did a lot of my work. I did, I guess, like the peak or where it really took off, my advocacy work in as a non-traditional student in a university setting. I had returned to school. I had like attempted college a few times, and finally, when I had my green card, I was okay. I think this is the time to finish it. And so I worked in higher education throughout my undergrad, and actually right at graduation was like the Latino Success Coordinator for the university I went to. And civic engagement, though advocacy work was really my passion. And I had to choose at that point because you can't work at a public university and do a lot of political things. And so I chose to go continue in that route. And so my advocacy work has, at first didn't necessarily marry specifically my previous experience as an undocumented immigrant. I mean, I did immigrant rights work and some civil liberties work, but it wasn't until 2019 when there was a lot of scares of immigration raids because of the Mississippi raid that happened, and that was the largest in U.S. history. That's when I started coupling much, much more of my experience as an undocumented poultry plant worker. Right out of high school, I had to work in poultry plants. I worked actually for a few years in poultry plants, even once I had gotten my residency towards the end. And that is the community that I would say most brought me to also work doing caregiving work. Because, during 2020, we had to figure out as a community how we were going to navigate kids not being able to go to schools, not having the same protections or the same relief as other folks. Have a lot of family members and friends who are still undocumented. And so the bulk of like the underlying work that we did with a group called Georgia Familias Unidas, which I helped co-found, the bulk of that was like, how do we address the pandemic for undocumented caregivers, right? Who are also like, peaking with being care recipients. My mother was working in poultry and had not really had much health issues until she became infected with COVID, and I had to move in and take care of her. And she's had long-lasting effects from there. And so I'm still a caregiver to her, caregiver to my children. And I have a child with autism. I have a spouse who also requires care. And then I myself am disabled. And so, these layers are layers that became very exacerbated for me doing the advocacy work that I started doing in 2019 with our undocumented community. And so that honestly was something that like stayed with me. And when I saw this opportunity open up at Carrying Across, there was actually another opportunity that I had seen that I applied for originally. And so when, we talked and the opportunity came that I could do organizing this work that like directly impacts, me, I said, yes, for sure. This is the way to go.
So can you speak about what you've observed over your years in the field about how, for people that are part of minority communities, how being part of that community might influence or impact their experience of living with a disability?
Yeah, definitely. So I can definitely speak on, my experience and what I've gotten to observe being in these spaces. So one of the things I would say that is common is an underdiagnosis of certain disabilities. I was not aware of my disability until 2018. And that's just 5 years ago. And having had this disability most of my life, it was not something that I knew or understood. And it wasn't until I had enough health coverage and exposure to like mental health. As a society, we're probably still destigmatizing those things. So I would say there is an underdiagnosis. I would also say that there's a like bit of a misdiagnosis as well. I think too often sometimes being in communities where you're, immigrant or struggling with English, or like flat out, like, if you're Black, you're not, a white person. There's sometimes a misdiagnosis, right? I think sometimes our school systems will be a little too quick to say this person's unteachable and this person isn't. That to me is shown in how we allocate resources for folks. And I say that too, I have been for the last 2 years requesting evaluation for my son, who I was first told by teachers who had like children with autism, hey, maybe your son has autism. Like, a lot of these things are things that I've seen in my own child, and as an educator, I've seen these things. And so for the last 2 years, I've struggled to get my son to have a like full formal diagnosis. And that's, there were some gaps for me in healthcare coverage. But outside of that, like the wait lists are long. We don't have a lot of doctors, right, that can provide those services. And in the school system, when I started asking for an evaluation for this, their first response was to put my son in ESOL. Mm-hmm. And so I think that was a misdiagnosis, right? And that was something that's very common. All of my siblings, since we were young, were placed into ESOL. I was placed into ESOL at a young age. And it took my father, fighting with administrators to get me out. And so I think that misdiagnosis is very prevalent, especially in in like multilingual families. We shouldn't be looking at multilingualism as a deficit, but mm-hmm. we do. But the undiagnosis, I think too, is like, for Latini communities, I think have the lowest percentage of healthcare coverage, but that's also true for Black communities, right? Not having adequate healthcare definitely means that you won't be diagnosed with what, is really going on sometimes. Sometimes by the time, we go to the emergency room, things have progressed significantly, or they're beyond what could have, been preventable. So I think those two things are what I see the most.
Tell us some of the initiatives that you're involved in at Caring Across, that and how it relates to kind of your personal narrative that you've told us about so far.
Yeah, so something that's exciting for me is our Care Can't Wait Georgia table, and we have that table in additional states. We're in California, in Michigan, and Illinois as well. And to see that this was, this is a table that has been very intentional about fleshing out what has been the goals. How do we push for a care narrative that actually, leads to more implementable programs. And as an advocacy nerd, I've been just really, happy to work with that this year. This year was the first year that we ever did a advocacy day at the Capitol. That was March 2nd. And, we did it very intentionally. There was a lot of training. We have an advocacy team that is incredible with like even breaking down what is HCBS, right? What are home and community-based services? Because that too, as someone who comes from a community where we didn't know that like these services exist and how Medicaid interacts with like care services, whether they're, in Georgia, they're more short-term. And I know the waivers were really difficult to navigate, but I think that this for me was the first time where I saw an organization actively trying to teach folks that like there's better benefits we could really be having as a population that is deeply connected to care. And what are those steps, right? So like, goals for us this session was to try to push for more funding for HCBS. Harp on the fact that like Georgia's Medicaid program and the waivers are still something that we could definitely improve on. There's a whole debate about increasing funding. We know there's federal funds that haven't been tapped into, but also taking on childcare, right? I have children ages, my oldest is 11 and my youngest is 1. And so childcare every single day, is a determinant for me and my spouse on whether or not we get to work that day, right? And provide for all these services. So that to me has been, what really pulled me to Caring Across and some of the work that we did this year that I have found most fulfilling.
And so you were saying Care Can't Wait. When you were starting talking about that, you were saying Care Can't Wait. You said something about table. What is that?
Yeah, so I call it a table, but it's like a coalition of different organizations that work in Georgia. Yeah.
So who all is involved?
Oh man, there's a large number. I mean, we have folks from like 9 to 5 Georgia, the Atlanta North Georgia Labor Council, Brain Injury Association of Georgia. I'm like reading from my.
Yeah, no, that's good.
Yeah, so Care in Action, Family Friendly Georgia, the Georgia Head Start Association, Georgia Stand Up, the National Domestic Workers Alliance that we're actually under as well, the New Georgia Project, Rosalind Carter Institute, Sibling Transformation Project.
Wow. Yeah.
There's so many. Yeah.
Yeah, a lot. So table is just kind of another word for coalition.
Mm-hmm,
okay.
Yes.
Gotcha. So, what do you think, like in these educational advocacy efforts, like what are some of the biggest surprises to people, like as you're getting these messages out there about what is available, like what are some of the things that people are surprised about that they didn't know?
Well, I think as it is, we're a right to work state, and a lot of folks are usually surprised too that we don't have more protections than what I think is believed. For instance, like we don't have a permanent paid leave policy, and only this year there was a bill in 2017 that made it so that employers who do have paid time off will allow their employees to use up to 5 days for like sick family members. That expired last year, and this year was brought up again, and is now waiting for the governor to sign off on. Those are things that folks are surprised for. Like, what? I thought that we could use PTO, but legally it hasn't been there, right? So I think some of those legal protections that maybe the better paying jobs allow you to have is something that is surprising to folks who are doing advocacy for the first time.
So, and what are some of the ways that Care Can't Wait and the work you're doing specifically relates to people with disabilities?
Yes, definitely. So, having a caregiver, having like those services provided to you at home is something that a lot of folks don't realize too. And it's hard to navigate the waiver program in Georgia. I myself am not the versed person to explain all of that, to our folks. But I would say that is one of the biggest ways, that like folks with disabilities benefit from the advocacy work we're doing. That and HCBS, having the ability, to have supportive housing or transportation, or even someone come in to like help you eat, bathe. HCBS, if we expanded the funding for that, would really fill in gaps that folks just need just to get through the day.
Mm-hmm.
Yeah.
Has there been anything encouraging, like in terms of progress that you've seen since you've started, and then maybe even going back before you, because I know you started in September, but like before, like over the past year, has there been have you seen some strides move forward just in terms of receptivity or actual legislation, or like what positive things have you seen from this coalition?
Well, I mean, this coalition has been doing, a lot of great awareness on it, and I think getting folks together to share their stories and to help identify the gaps is probably one of the best things that you can do when you're starting off as a coalition, like specifically in Georgia. But under the Biden administration, I think Carrying Across has really great relationships, pushing for awareness, whether it's like getting the White House to push out like, yes, like Medicaid needs fixing, right? Like we need to have more funds for this, or even just with the ARP funding that came for care workers to be able to have paid time off, especially when they're exposed to COVID and they have to wait, right? Like that implementation is significant. That's happened in the last couple of years. And Now that there's a nice like coalition, we had a lot of folks at the advocacy day who spoke on like, hey, these ARP funds were supposed to cover for me while I was out sick or exposed to COVID, but they haven't, but that hasn't been implemented the way it's supposed to be. There's a lot of unused ARP funds right in Georgia, and so bringing light to that issue is something that I think this coalition has uniquely been able to do.
If you could summarize the and I'm sure there's a mission statement that you could reference or something, but like just for people that don't know anything about Care Can't Wait, like what is it? What's it all about? What's the goal? What's the mission?
Yeah, so for Georgia, we want to specifically build an infrastructure for Georgia's older adults, disabled people, family caregivers, and care workers. So that's our goal as a coalition, right? Just to build that infrastructure.
Absolutely. So is there anything else that like we've touched on or that came up as you were talking that you wanted to say more about before we wrap up?
I think that we have a long ways to go to chip away at what infrastructure we really need for care in Georgia. And I think that I'm very hopeful because there is a coalition of folks and there's just incredible folks who are advocates in this area too, that have been doing this for a really long time. And so I'm just thankful for that, for the history of advocacy in Georgia. And Georgia is a beautiful place to work in. There's so much rich history here with civil rights. And we have so much to learn from the movements and the leaders that have existed here for a while. So I'm just one, very thankful for that. And two, also acknowledge that we have a long ways to go. And so, yeah.
That's great. That's a great note to end on. Thank you so much, Rosario, for taking the time to share about your work and just thank you for the work that you're doing.
No problem. Thank you for having me. This has been great.
And we'll end today's episode there. For more information on Rosario's work, you can visit caringacross.org, or you can learn more about their major initiative at carecan'twait.org. Accessibility Now is a podcast produced by the statewide Independent Living Council of Georgia. I'm your host, Matt Shedd, and I just want to close by reminding you that a Georgia that includes everyone is better for all of us.